We're glad you're with us today. You've probably heard us talk about it, whooping cough, also known as pertussis.
It's been seen in multiple counties across Kentucky, and it continues to be a problem. Jill Keys and Molly Roberts from the Fayette County Health Department are here to tell
exactly is pertussis.
So pertussis is a respiratory illness. Like you said, it's also called whooping cough or whooping cough, and it's spread by coughing or sneezing, and it's highly contagious and particularly more of a concern with infants and people with chronic health conditions, health diseases, but it can affect people of all ages.
And can be very serious.
It can be, yes.
Yeah, because the symptoms are pretty serious, right?
Yes, and they can vary. If a person is vaccinated, then typically the symptoms are much less. But the cough can be very dangerous, especially to the infants or those that are not vaccinated.
Now, there is a vaccine for this, but so I guess the question is, why do we see so much of it still popping up?
Well, typically the vaccine is required for school entry. So there's a primary series that they get before they go into kindergarten, and then there's a booster dose that they get at middle school. And that's really because that vaccine protection can wane or can decrease over the years. And so that's the reason we really want to get that booster dose. But then again, if they do get the disease or get pertussis, then it is much less frequently if they've been vaccinated.
Yeah. So obviously, as public health professionals, prevention is key from your standpoint. You are telling people that in these risk areas, they should certainly have that vaccine?
Yes, we are. And as we see cases, we make recommendations based on specific situations. So like with the instances with cases in schools, then we reach out to parents of that school and make sure they all know, depending on when the cough started and a child who had it, what the proper steps would be at that point.
So it seems to happen in these clusters. I mean, more than the general population needing to have a vaccine.
Yes.
Yeah.
When we're talking about school-age children getting vaccinated and all that, it is not limited to school-age children. Who should be getting this vaccination?
Really anyone, as I said, the primary series is before they enter kindergarten, and then there's a booster dose at middle school. But if you didn't have that booster dose at middle school, then really anyone that hasn't had it should talk to their medical or their healthcare provider. Anybody that's going to be around an infant, especially younger than 12 months of age, or anybody that has a compromised immune system. So really everyone should be vaccinated.
So that would
really check that one.
A caregiver, I mean a parent, a grandparent,
yes.
Anybody like that. Thanks for coming in. Good information. We appreciate it. Of course, folks can visit your website.